And I want to go to Capitol Hill to talk to Republican representative from Wisconsin, ranking member of the House Budget Committee, and yet another man who has not signed the free Roman Polanski.
No, he is not.
He's thinking about it, though.
He's thinking about it. You watch the day.
Take your time, Congressman.
The day after the election, I swear to God, he's going to sign the Polanski deal. Hey, let's bring in House Budget Committee Congressman Paul Ryan. Paul, good to see you here.
Hey, good morning, everybody.
We understand yesterday the Democrats said they're going to have a robust public option. Now Nancy Pelosi says, tells Politico privately, or her staff does, she doesn't have the votes. Where do you think we end up on this health care bill?
Well, I've heard that, but I think they got about 2 more weeks to try and collect these votes. They've slipped the date on the bill coming to the floor to the first week of November. They're going to try in that intervening time to get the votes for this bill. In the Senate, they had a problem where they couldn't pass this doc fix gamble, which was they're going to sweep about $250 billion of deficit spending under the rug by passing in another bill. That means they're about $200 billion shy of actually making this bill add up on paper. So they've got a funding problem. They're going to have to find another tax increase to replace that lost revenue. And then they got a vote problem. Well, they're going to have to bridge that in the next 2 weeks.
Lawrence O'Donnell was saying they've got a big funding problem. Are the Democrats in the House talking about just an overall tax increase on wealthier Americans? What are they talking about?
That's what they want to pass here in the House, and they have the votes to pass this income tax increase, I think, in the House, but I don't think that can pass the Senate just as much as you cannot pass the Senate tax on health care benefits in the House. And so the problem is the big tax increase that is used to finance the bill in the House can't pass the Senate and vice versa. So they're out there looking for some other tax increase they can pass both chambers. So they've got about 2 weeks to do that. Not to mention the fact that this still creates a huge deficit in the outer years, in my opinion, because this new entitlement program is going to create like a $1 to $2 trillion liability. And what history tells us is we always underestimate how much these things cost, and we always underestimate how much money we save to pay for these bills.
Lawrence O'Donnell?
Congressman, do you guys have some alternative funding mechanism that you would suggest for legislation like this?
Well, I have an alternative bill. Tom Coburn, Richard Burr, Devin Nunes, and I have an alternative bill, which is use the tax exclusion. Don't take that money and give it to the government to create a new entitlement. Give it back to the individual so we treat everybody the same. So we stop discriminating against people in the tax code when they get health insurance. That's a universal benefit.
But within the bill, within the bill that the Democrats are trying to pass, I assume you people will be opposing every form of pay-for that they're using in the bill.
We are opposing creating a new entitlement that involves the nationalization of health care and the government taking over health care. So why would we want to come up with some tax increase to pay for a legislation that we absolutely do not support?
Mort Zuckerman.
Okay, just in a general way, if you were trying to propose various ideas to contain the explosion of health care costs, do the Republicans have any approach that they're putting forward to the American public on that issue?
Absolutely. A couple of things. Interstate shopping for health insurance, medical liability reform, more transparency on prices and quality so you actually know what things cost before you get it. And I really think you need to equalize the tax treatment of health care and incentivize the kinds of plans like high-deductible HSA plans so that people have skin in the game so they actually know what things cost and they care about it. The problem with health inflation is when you buy health care today, you're usually doing it with somebody else's money. You don't care what things cost because someone else pays the bills. We've got to fix that and address that and go after health inflation. And you can do this in a way that makes sure everybody gets insurance.
Okay. Hey, thanks a lot, Paul. It's always great talking to you, Congressman Paul Ryan. You know, he touched on, and I hadn't read